welcome you all to today's session. Today's session I am going to focus on the technique of facelift. The facelift surgery is essentially a surgery to tighten the face. As we age, there is a lot of sagging in the face, and facelift gives us a very nice and tight face where the lines look less visible, and that gives the appearance of a youthful face. It makes the face look fresher, and therefore I thought it's a good idea to discuss the different techniques of facelifting and also to explain to you what are the latest advances in facelift surgery and whether you are a good candidate for facelifting. I am Dr. Parag Telang. I am the founder and director of Designer Bodyz, our Center for Advanced Cosmetic Surgery located in Mumbai, India. You can follow me on Instagram on Dr. Parag Telang and of course on this YouTube channel. So friends, as we age, what happens is we tend to develop lot of sagging in certain areas of the face. There is loss of volume in certain areas. So aging is a combination of loss of fat and sagging. We have to analyze a person's face to decide whether he or she is a good candidate for facelift. So let me explain to you, when a patient comes to me, how do I decide whether he or she is a good candidate for facelift or not. Take a look. As we grow older, there are a lot of changes that happen in the face. You can see that there are a lot of wrinkles that start developing. There is overall appearance of sagging in the face. So the skin, which was tight and firm before, starts becoming loose and wrinkly, and this appearance is what we call as facial aging. If you compare these two photos of a mother and daughter duo, you will realize that the daughter has a skin which is very nice and tight, and therefore her face looks young. The mother has face which is sagging. She has a face where there is loss of volume in certain areas, and all this contributes to her appearance of aging. Just by looking at the photo, we can tell which is a young person and which is an old person, primarily because of the difference in the skin sag. So what is it that makes our face look older? Are two main components: loss of volume and loss of tone or sagging. As we age, there are visible signs of aging that happen on our face. So there can be lines on the forehead, there can be hollowing in the temple area, and there could be changes in the cheeks and in the laugh lines and lower part of the face. So depending on what is the area that is affected the most, we can customize a treatment plan for a patient. Tractors and Technology Sanjeev is saying, hello doctor. Thank you Mr. Sanjeev for attending. Listen in. So how do we reverse these signs of aging is by repositioning the tissues which have sagged, by refilling the areas which have become hollow or where there is loss of volume, releasing the ligaments and refixing them to a higher location. So these signs of aging are essentially droopiness of the corner of the eyebrow, wrinkling in the skin of the corner of the eye, droopiness in the cheeks, prominence of the laugh lines, and prominence of the crease under the lip. These are the predominant signs of aging that most of the patients develop. So what is the need for a facelift? I am sure most of us stand in front of the mirror and try to push the skin upward or backward in this manner, and that makes us look younger. So this process of pushing the face skin backward is something that we actually do during the surgery, and that's how we make the face look younger and fresher. So let us understand how this surgery called facelift is done to make you look younger. So what has changed over the period of time from the 20s to 30s to 40s, 50s and then 60s is that the appearance of eye bags keeps on increasing, and there is prominence of this laugh line, and there is a general sag. If you see how tight her skin of the cheeks is and how it starts keep becoming loose, and how by the 60s she has got a sagging. So this is what has changed with aging. So facial sagging is something we cannot control. Of course, certain actions such as loss of weight or multiple pregnancies or too much of weight fluctuation, all of this can speed up this process of facial aging. So some of us start looking older at an early age. Even when they are 30, 40, they look older than their age, and others, the face is quite well maintained till late in the 50s or 60s, but by the time we reach 60, 65, there is a definite chance that the facial sagging will start being quite noticeable. So what are the ways or what are the techniques of improving this facial sagging? So this facial sagging can be reversed by lifting the face by performing a surgery called as a facelift. So what are things can be corrected by facial surgery such as a facelift is lifting of the saggy skin of the neck, tightening of the muscle bands on the neck, removing the bands on the neck, giving a proper jawline definition, and improving the contour of the jawline. So this contour of the jawline can be well seen only when the neck muscle has been made tight and when the excess loose skin has been removed from the face and the neck. As long as the facial skin is loose, it can never be possible to get a proper definition of the jawline, because this loose hanging skin is going to cover the jawbone all the time. So this is a short video that I made to show you whether a person is a good candidate for facelift or not. If you look at this patient, she is quite young, and when I am trying to press her skin upward, there is hardly any movement of the skin because her skin is already nice and tight. And if you look at the other patient who is little bit older, when I am doing this, you see how much of skin moves with the pressure of my thumb. So she would be a good candidate for a facelift surgery. Practice and Technology Sanjeev is saying, for chin correction, which is the best, internal or outer? My chin is wider than normal. Both the approaches have their own pros and cons. You can do it internally, is better because you avoid an external visible mark. Recovery is the same for whether you go for internal or external, doesn't make any difference. So how is facelift performed? Facelift is performed by first taking an incision. Now this incision is concealed in the sideburn, then it curves in front of the ear and goes in the crease of the lobule of the ear and then curves in the crease behind the ear. First the skin is lifted up like the page of a textbook as has been shown, and then the internal portion of the facial tissues, which is called as the smash layer, that smash layer is then cut and it is tightened or lifted and fixed to a higher location. This surgery is called as a facelift. So this tough layer of tissues, which is called as the smash, is the layer of muscular tissues which is under the skin, and this is a very tough layer. So we can create two separate structures out of it, one for tightening the muscle of the neck and one for tightening the muscles of the face, and these are then stitched to a higher location, for the face somewhere here and for the neck somewhere behind the ear. And this pull, what is shown by the arrows, is called as the vector of tightening of the smash layer. So in the face it is in upward direction and for the neck it is in backward direction, and when this smash layer is tightened, it gives a wonderful rejuvenating effect to the face. It makes the face look absolutely nice and tight, and the best part, there is no maintenance. The effect of a facelift can remain for 8 to 10 years or even more. So the incision remains quite concealed. You can see that the incision starts in the hairline, curves in the crease in front of the ear and then goes behind, and after the surgery the only visible part is this small portion. Rest is all in the hairline, and even this little portion will get faded away in a month or month and a half. So facelift is a very effective treatment for tightening of the face. So let us take a look at some examples. This was a 58-year-old lady who had all signs of aging. There was a lot of loose skin in the neck as well, and there she is 1 month after her facelift, and you can see that the hollowing on the cheeks has got corrected. She has good volume on the cheeks. Whatever was the loose hangy tissue here in the jowl has got completely corrected. If you look at her jawline, you will see that now she has a proper precise jawline with good definition of the contour of the jawbone, which was not there before because there was lot of loose hangy skin in the neck area or in the jowl area. If you look at her profile view, you will see the tremendous difference that she has in the neck. So in the pre-surgery photo, you will see that there is a lot of loose muscle which is hanging and the definition of her neck is not seen. And when you see in the profile after the surgery, you will see that she has a proper contour of the neck, and this definition of the neck is not possible by any non-surgical modality. Only a facelift surgery has the power and the capability to give you this kind of a jawline. So this kind of a result is definitely possible, and we can definitely help you achieve these kind of results. Shri Gurudev Datta is saying, sir, मेरी बच्ची की सर्जरी का, just one second, I'm reading his message. बच्ची का कराना है ईयर प्लास्टिक सर्जरी. श्योर गुरुदत्त जी, आप मुझे मैसेज करिए और आपको मैं क्लिनिक के फ़ोन नंबर्स भेजूंगा जिस पे आप हमें कांटेक्ट कर सकते हैं. जेमी कैस्टासियन इज सेइंग हेलो हैंडसम डॉक्टर. थैंक यू जेमी, थैंक यू फॉर ट्यूनिंग इन. I hope this live is of interest to you. Sadia Akhtar is saying hi. Hello Sadia ji, thank you for tuning in. So continuing with our discussion, a facelift is not only going to tighten the face, it's also going to tighten the neck muscles, and that's how we can create results which are long lasting, which are stable, and where nothing is visible in terms of any incision mark or any visible sign of having had a surgery. This was another patient who had lost more than 15 kilos of weight. He was 48 years old, but he used to look 60 because of loss of volume. You see here how deep the cheeks had become because of his weight loss, and you see after the facelift how nice and tight his cheeks are looking. You can see that the creases which were very prominent before the surgery have been markedly reduced, and the cheek area looks nice and smooth. Let us see him in the profile view, and in the profile you will appreciate that this entire sagging part of his face has got nicely corrected, it has got nicely tightened, and look at the jawline. The jawline has become absolutely tight and like a young man. This was another lady who was basically concerned by the sagging on her eyebrows. You can see that the eyebrows have started to sag. Along with the sagging of her eyebrows, the laugh lines had started being prominent, and there was loss of volume in the under eye area. You see how hollow the under eye areas are and how prominent these creases are. And we did a lifting of her eyebrows, which is called as a brow lift, and lifting of the central part of the face, which is called as a mid face lift. And you can see after the surgeries that now the eyebrows are nice and lifted, and she has a proper arch of the eyebrow, and because of lifting of the cheeks she has good volume in the under eye area, and the laugh lines have almost disappeared, and she was very thrilled and happy with the result. This is her profile picture where you can see that the hollowness under the eyes has got corrected. The eyebrows have got a nice lift. The laugh lines which were becoming prominent have got corrected. You can see in the other profile similar changes where the laugh line is completely gone. The under eye hollow is completely corrected. And if you look at the shape of her eyebrows, she has beautiful shape of the eyebrows. When you look at the profile view, you see before surgery how flat she was, and you see after the surgery how nice a contour of the cheeks she has after the surgery. And the best part is that there is no maintenance. She does not need to go to her doctor for another maybe 8 to 10 years. So facelift definitely is something where the effect can be expected to last for many years, 8 to 10 years. The only thing you need to do after a facelift is you need to maintain an adequate body weight or a stable body weight. Those of you who have a lot of weight fluctuation where the weight increases and then decreases can also get sagging on the skin, because the skin is like an elastic. You need to maintain a constant body weight, and then you'll be able to maintain the results of your facelift for much longer. Facelift is a surgery which is done under general anesthesia. Some parts of the face can be lifted even under local anesthesia, but when it's the whole thing, the face, the neck, the eyelids, we prefer to do it under general anesthesia. It normally takes between 45 minutes to 2 hours per side, and preferably one night you will be admitted in the hospital. The recovery time of the face is such that the swelling and the bruising is visible for the initial 8 to 10 days. So those of you who are office going, I would recommend at least 2 weeks of time before planning this kind of a surgery of the face. Those of you who are into shoots or who will be in front of the camera, at least 1 month before your shoots is recommended, because now everything is on high definition, and on HD it can easily catch even minor anomalies or minor blemishes on the face. So friends, this was a brief overview about a surgery called as facelift, which is for tightening the different areas of the face to make it look younger and fresher. And as I said, the best part is no maintenance. So those of you who are tired of doing repeated injections of botulinum toxin or getting injected with hyaluronic acid fillers all the time and spending money every year on the maintenance, this is a wonderful option. You don't need any maintenance for at least 8 to 10 years. So think about it. I hope you found today's session to be of interest, and if you have any other questions for me regarding facelift, just message me after this video and I will be happy to answer your questions. I thank you all for attending today's live, and I will catch you soon with another topic of interest. Till then, stay safe and stay healthy. Good night.